Top tips for your recovery in the first few days after giving birth from the Pelvic Health Physiotherapy team. Congratulations on the birth of your baby. Your body has changed a lot during pregnancy and it can take several months to fully recover. Here are a few top tips to help you in those first few days as a mum. Top tip number 1, pain relief. Take your pain medication as prescribed by your midwife or doctor. This can help you to be able to move around comfortably and to look after your baby. For perineal swelling or discomfort, try applying something cool to the area. Wet a clean maternity pad and place it into a bag in the freezer. Once removed, you can then wrap this into a damp clean cloth and apply it to the genital area for between 5 to 10 minutes. Once finished, you can dispose of and repeat this process several times throughout your day with a clean maternity pad. However, if you are experiencing numbness in the genital region, do not apply anything cool to the area to avoid skin damage. Top tip number 2, moving around comfortably. Start walking or moving around on the ward or at home short distances. Avoid standing or walking for periods of over 15 minutes and to break up walking around with periods of rest in a supportive, comfortable chair. To avoid overstraining your abdominal muscles, try moving around in some of the following ways. When getting in and out of bed, try to bend your knees, roll onto your side so you're leaning onto your shoulder and to your hip, and then use your feet dropping off the edge of the bed and your elbow to help you push up into a sitting position. If you've found that you've slid down into your bed, to help you reposition more comfortably, bend your legs and push down into the bed with your heels to help you wriggle or slide up the bed slowly. This can help avoid straining those abdominal muscles that may feel weak or uncomfortable at this time. Top tip number 3, exercises in the early days after birth. Whilst you will not be moving around as much as you usually would be, please try the following breathing and circulation exercises every hour. Deep breathing. In a good upright sitting position, take a deep breath in through your nose. Hold that breath in for a period of 2 to 3 seconds, feeling your chest fully open like a balloon, and then breathe out through your nose or your mouth. Repeat this 5 times. Ankle exercises. Either in a sitting position in bed or in a chair, pump your ankles up and down repeatedly for 30 seconds. This will help promote good blood flow and avoid any swelling. Top tip number 4, go for a wee every 2 to 3 hours. In the daytime, try to go back to a routine of going to the toilet for a wee every 2 to 3 hours. This can help to try and recreate a normal bladder routine now that you have finished your pregnancy. Top tip number 5, good bowel routine. After having a baby, it is important to avoid straining when opening your bowels, as this can place extra pressure and stress upon the pelvic floor and abdominal muscles that will be recovering after your pregnancy and delivery. After having a caesarean section, it can be common to have trapped wind and constipation. It can also be common to feel apprehensive about opening your bowels after having had perineal stitches. To help create a good bowel routine, try the following. Try to drink 1.5 litres to 2 litres of fluid a day. This equates to about 6 to 8 cups of fluid. Try to eat a healthy, balanced diet with fruit and fibre. Also, try not to delay the urge to go to the toilet. This can only sometimes make it more tricky to open your bowels. How to poo comfortably. When opening your bowels, sit relaxed on the toilet with your elbows on your knees. A footstool can be beneficial to help raise your knees to be higher than your hips. Do not strain. Instead, try to relax your tummy and pelvic floor muscles. For comfort, you may find giving support to the perineum area with a clean maternity pad beneficial. If you are still struggling to open your bowels, we recommend you approaching your doctor or midwife, who could see you and discuss with you the option of trialling stool softeners or laxatives to help you go more comfortably without the need to strain. Top tip number 6. Start your pelvic floor exercises as soon as you feel able to after birth. For further information on how to perform your pelvic floor exercises correctly, please see the relevant video.
Thank you for watching the video. We hope that you found the information useful. Now we need just a few more minutes of your time if possible, please. We as a team have put together a little survey to find out some more information from you to see if we can improve the service for future mums. If you click on the link down below in the comments underneath this video, it will take you through to the Survey Monkey. Thank you very much for your time.